Lois, type 2 diabetes. This one is actually the most common.
That is the most
Okay.
common. 90% of individuals have type 2, and it's actually the more complicated disease.
Why?
One might think, oh, type 1, it happens to children. It's absolutely the more serious one. And there isn't a more serious or a less serious. The name of the game is, what are your blood sugars and how well controlled they are, regardless of which type. So if your blood sugars are high, whether you have type 1 or type 2, that's the serious one. But if your blood sugars are kept closer to normal range, then it's less serious. But type 2, actually, there could be a bunch of things happening in type 2. First of all, the body may produce less insulin than needed, or the body may not actually recognize the insulin that's already being produced. Then there could also be a problem with the liver. The liver stores extra glucose in the body, in the liver, to be able to turn it over when we're not eating. And unfortunately, instead of turning it over to normal amounts to compensate, it overshoots and turns over too much. Then another problem in type 2 diabetes is that the kidneys, the actual tubules of the kidneys that filter out toxins, actually withhold back more sugar than it should. So that adds more sugar to the bloodstream, making it even more complicated. And then if that wasn't enough, there's actually a fifth defect where the hormones in your intestine do not send the proper signals to the brain, which then tells the brain to talk to the pancreas to make insulin. So it's a very complicated process, which is why there are so many different types of medications now for type 2.